is to give you just some basics about types of learning. Did Namiko talk about this at all? How dogs learn? How we learn? Did she talk about any of this at all? Okay. So you're familiar with classical conditioning versus operant conditioning. Okay, classical conditioning is learning by association. Operant conditioning is trial and error. That's what almost every living species does. That's survival of the fittest. You try something, if it works, great. You continue that and you try to improve upon it because that's how you survive. If it doesn't work, it's not efficient, it's not going to be successful for preservation of the species, so you abandon that behavior. So we use those techniques in animal behavior training every single day, and it's happening whether you are specifically taking time to say, I'm going to take 15 minutes to train my dog. They don't turn their brains off, so they are learning all the time. So that's another thing to keep in mind, particularly working with your clients, is that in behavior medicine, very often the stumbling block for a lot of clients is, I don't have my time to take my dog to class, I don't have time to set aside 30 minutes out of my day to train my dog. What you have to convey to them that the things that they can do, particularly the prevention things that Namiko was talking about, those are things that need to happen in daily life as life is happening, and take advantage of the opportunities that occur in real time. So that's another really important thing to convey to clients, that this is not about you have to add another thing to your busy day. It's teaching and training as the events are happening. When we're doing behavior modification particularly, we're going to use a lot of classical conditioning for two very specific techniques. One is called counter conditioning. And what we're basically doing when we're doing counter conditioning is we have a dog that has a fear, a phobia, some aggression to a specific situation. We are trying to change the dog's emotional state in association with a specific person, an object, a situation, an environment. And so we're going to use classical conditioning to actually modify that behavior and hopefully turn a dog's bad association and inappropriate behavior into something that is a good association. And you're going to use that in situations where you can't change the fact that people are going to go by your house on bicycles and your dog is afraid of moving objects or afraid of motorcycles. You have no control. You can't change the fact that if you take your dog out for a walk, you might encounter another person walking their dog on the opposite side of the street. So the only opportunity that you have to manage that part of the environment for the dog is to change the dog's response to that situation. Certainly one of our key factors when we're dealing with behavior modification is always to manage the environment. You don't want your dog to get in the trash, don't put the trash where the dog can get it. People will ask, how do I teach my dog not to get into the trash? Well, you certainly can teach a dog not to get into the trash, but that's a behavior that's going to be on cue. So you have to be there to present that cue to the dog, don't get in the trash. What the dog learns is, trash is out, people aren't here, opportunity knocks, I'm getting into the trash. So then people come home, it's like, oh, you got in the trash, I'm so upset. You know you're not supposed to go in the trash. Well, all the dog knows is I don't go in the trash when you're here. You can't teach the dog, well, don't do that stuff when I'm not here to give you the cue. So that's where management comes into play. You can put your trash can someplace where the dog can't get it, or you can put the dog in a crate when you're gone. So then you can leave your trash out. The dog just can't get to it. So those are techniques that are very simple about managing the environment. But when you can't manage the environment, counter conditioning is hugely important, and we can use it a lot in a veterinary context, especially for day-to-day procedures. Getting a fearful dog into the veterinary hospital and being calm and relaxed for just coming through the door and going into the waiting room. Desensitizing them to having their nails trimmed, having their ears cleaned, to grooming procedures, to having a blood draw. So there's a lot of things that you can use or apply to things that you're going to be doing day to day in your work in the veterinary hospital. The other form of learning is what's called operant conditioning, and that's trial and error. And the technique that we use most commonly for operant conditioning is clicker training. And the clicker is basically a marker. So it's a predictor for the dog. And the reason that we use the clicker is because it's very consistent. When our cues are inconsistent or they're variable from person to person, from situation to situation, from day to day, that's very confusing for the dog, and especially for an anxious or a fearful dog, it will only make their situation worse. The clicker is always the same. So you can be mad and do that, and it still sounds the same to the dog. The other thing is that because of the consistency, it's predictable for the dog or any other animal, because quite honestly, clicker training applies to any species, but you want something that's predictable. So part of the whole foundation for clicker training is the click marks the behavior, but it's always followed by a reward. So it becomes a predictor for the dog. When I hear this click, I'm going to get paid. And that's a good response. It may be, typically it's paired with a food treat, but for some dogs that aren't food motivated or have a lot of dietary issues where treats are difficult to find, sometimes praise or play with certain breeds and in certain specific arenas. For example, dogs that do agility, getting to go run an agility course is a reward. So you can use different rewards to pair with your clicker, but you have to remember that once you get the behavior and mark the behavior, it always has to be rewarded. If you kind of turn it into this slot machine where sometimes I'll reward you, sometimes you won't, you're going to totally negate the effect of your clicker. It no longer becomes a consistent predictor of what's going to happen for the dog, so they'll learn to ignore it, and you've just damaged one of your most powerful tools for training. So what I'd like to do is go through a few videos that are used by Dr. Sophia Yin. She's a veterinary behaviorist, and she uses a lot of these techniques in practice situations, both in the hospital and working with veterinary procedures. So I have some of her video for us to go through, just day-to-day procedures that you're going to encounter in veterinary practice. I brought clickers for everybody, and I see we have some dogs that look like they're taking a siesta, so but hopefully we can get them up and do a little clicker work with them. Who's got the dog? Is this yours, Tiffany? Okay, and then I saw Golden over here. Okay. Do they have any issues with particular food allergies at all?
Well, I do get gas sometimes, but
okay.
whatever you have.
And I have like chicken, gluten-free,